There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
Can you be sure? I mean, you hear from coroners that that's not necessarily the case. Are you sure? How can you be confident about that? And is there any concern that it skews the data that you're trying to collect in terms of projections and things like that?
Areas that may not have the same level of testing, but I am pretty confident in New York City and New Jersey and places that have these large outbreaks and COVID-only hospitals. I can tell you they are testing. New York and New Jersey together have, by proportion, are testing extraordinarily well as Washington State and Louisiana. So I don't see that there's been a barrier in testing to diagnosis.
As a physician, I received an email last week from the Department of Health coaching me on how to fill out death certificates. And I've never really received coaching from the Vital Statistics agency in terms of how to do a death certificate. But basically, I felt like they were saying, you don't have to have a confirmed laboratory test for COVID-19 in order to make the death certificate be COVID-19.
At this point, that most people who test positive for COVID-19 have mild or no symptoms. Therefore, testing positive for COVID-19 does not mean a person is sick with it, or if the person died, that they died from it. To drive this home, we need to understand how the CDC and National Vital Statistics System are instructing physicians to fill out death certificates related to COVID-19. Brace yourselves, and please pay attention, and let what I'm about to tell you sink in. The assumption of COVID-19 death can be made even without testing. Based on assumption alone, the death can be reported to the public as another COVID-19 casualty. The March 24th, 2020 National Vital Statistics System memo states, and I quote, "The rules for coding and selection of the underlying cause of death are expected to result in COVID-19 being the underlying cause more often than not." End of quote. The CDC report of cases in the U.S. memo from yesterday states the death numbers are preliminary, quote, and have not been confirmed. So, quote, "The results are preliminary and have not been confirmed." End of quote. It's from the CDC website. Here's a quote even more laden with meaning. Stephen Schwartz, National Director of the Division of Vital Statistics, says in answer to the question as stated in the organization's COVID-19 alert, quote, "Should COVID-19 be reported on the death certificate only with a confirmed test?" Check out his answer, and I quote from this memo, of which I have a copy, quote, "COVID-19 should be reported on the death certificate for all decedents where the disease caused or is assumed to have caused or contributed to death. Certifiers should include as much detail as possible based on their knowledge of the case, medical records, laboratory testing, etc." End of quote. I'm sure you all feel so reassured the government is asking doctors to provide their very best guesswork. Not. Fact, quote, "COVID-19 caused death," end of quote, and, quote, "assumed death by COVID-19," end of quote, are not the same thing. And for those who died from something else and had an incidental finding of COVID-19 positivity, dying with COVID-19 is not the same as dying from COVID-19.
critically important. Can you repeat what you just said, please?
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19. Now, we've not done that. If someone has the pneumonia after, and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but my heart is sinking right now as you're telling me this. You're a doctor. Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate this person's death was caused by COVID-19? That does not sound right to me.
I went to the person in our office who does most of the death certificates over the last 10, 20 years, and I said, does this sound right? I had her look at the documents that I printed off, and she said, well, we've always been told that you always put down just facts. You don't put down any probabilities. You don't put any presumptions down. It's just what you know. And so this is concerning. And it actually gets to your point, Chris. When we start talking about the data that goes into the modeling, we have to ask ourselves a question. Are we being forthright? Are we sharing with the public? Minnesota, North Dakota, we don't need to be having it sugar-coated. We want to know what's going into your modeling.
So with that being said, why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people. And fear is a great way to control people. And fear is a great way to control people. And I worry about that. I worry that sometimes we're so darn...
I just am so frustrated. Like, as a doctor, it's my job to take care of my community. That's my job. You doctors that are watching this, and I see a lot of you right here, why are you not getting loud? I just told you the fake news about the kid in Louisiana. There was a baby that was born 22 weeks early because the mother had tested positive for COVID-19, went into distress, forced to go into labor, and the baby died. And the headlines were "Baby dies of coronavirus." Now, did you guys see earlier last week or late last week there was a story out of Connecticut where the governor came out, tweeted, and said a child, an infant, died in Connecticut of coronavirus. And then the parents came out and said, no, my child did not die of coronavirus. My child had an accident at home and died from that. It is just crazy. Please, you guys, go back and watch this, share this, because I promise you this video is going to get removed today. I promise you that there's no way in hell the powers that be are going to let this video get out. I promise you. And by the way, I can promise you this. Next month, I'm going to get more audits from the IRS, from the insurance companies, from Medicare, and everybody else, because when a doctor speaks up and speaks out about the truth, the powers that be come after the doctor to suppress him and shut him up. That's the world we're living in right now. How many of y'all think that's okay? It's not. Now, I'm telling you right now, we can get healthier. We can beat this stuff, but we got to wake up. We got to start seeing. It's 2020. It's time to start seeing the world of 2020 vision. And I'm telling you right now, you need to wake up and look around. Next time you see a major headline, look for the story that brought that story out. Look and see, well, wait a minute, that doesn't make sense. Your spider sense started tingling. This is not real journalism, people. Right now, what should be happening is people should be going to hospitals right now. I mean, independent people should be going and ask to volunteer at hospitals and see how crazy it is. Journalists should be going inside of the emergency rooms and the...
Man, let me tell you, it take days. They tell us here it take 24 hours. You feel what I'm saying? They didn't swab me or test me or nothing to look what the fuck paper say. Reason for visit, fever. Diagnosis, COVID-19. They didn't test me for this shit. He told me I had it, bro. He didn't test me for it. He told me I fucking had it, bro. He told me I fucking had it, bro. Come on now. Come on now. Look at what my temperature was. I ain't even had no temperature when I went in that bitch. Come on now. But because I told him I can't taste and smell, he know I got it. Oh, well, that's the number one symptom that's been going around lately is the smell or taste. So I'm not going to say, we're just going to say you have it and quarantine you for 2 weeks. That's exactly what he said, bro. We're just going to say you have it. We're just going to tell you have it. So they diagnosed me with corona.